About 25 years ago, I was working in a very large ED in Cincinnati, and part of our contract was to rotate out to a rural hospital in Indiana about once a week. I was working there one night, and the nurse awakened me at 2 in the morning. It was just her and me, told me we had a very critical patient. His heart rate was about 20, his blood pressure was very low. He was barely responsive, and since he was brought in by ambulance, we knew very little about him. He was deteriorating very quickly. So I decided to put in a transvenous pacemaker, and luckily it captured very quickly, and he improved dramatically. By that time, the family had arrived, and I went out to the waiting room to talk to him, explained what had happened. The daughter stopped me and said, wait, did you put in a pacemaker? And I said, well, why? And she said, well, he's on a cardiac transplant list, and the cardiologist told me that no one should ever try to put a pacemaker in him because his heart wall is so thin it would kill him. I did put a pacemaker in him, and it saved his life. Long story short, we flew him to the transplant center. He got his transplant, recovered, sent home. A few days later, there was an article in the paper that described his miraculous journey and his recovery. And the family went out of their way to say that I had saved his life in that article. It's really a special feeling to make that kind of a difference in a family's life. That's why we do what we do.